Forging a Food System for Our Future, Food Law and Policy. The significance of this topic is clear to bring so many people at 2 o'clock in the afternoon in the hottest June in the memory of Mississippi to this place. I also think it came because we have truly an outstanding lecturer to present a very timely topic, and I think the second reason surpasses the first. Emily Leib, Emily Broad to me, because I knew her before she was married, came to Mississippi 3 years ago in a collaborative arrangement that MSU has with the Harvard Law School. And the nature of this is that we jointly fund a position to work in the Mississippi Delta. And we didn't know exactly what the topics would be when we started into this agreement, but it gravitated very quickly to food and food policy and all sorts of other activities we were interested in terms of economic development, human development, seemed to spin off nicely from that central theme and that central topic. So it's, I think we were profoundly fortunate that we quickly arrived at that as a focus of activity. Now about Emily. Emily is a graduate of Columbia with a degree specializing in military history, which really prepares her well for a trip in Mississippi. And for those of you history buffs, she focuses on the Second World War is her really keen interest. Then she went from there to the Harvard Law School and worked on a number of projects, and she has publications in things like cluster bombs and the control and the international control of cluster weapons. But when we started interviewing for the first Delta Fellow, she came into the applied, and just absolutely we were so impressed with her that we recruited her very, very energetically for the position. She spent 2 years in Mississippi, the majority at Clarksdale in the Mississippi Delta, doing a number of things that she will talk about, and I will not take those. Upon completing her 2-year agreement for this first Delta Fellow position, she returned to the Harvard Law School. She's the senior Delta Fellow in the clinical program, in the health clinical program at Harvard. And she supervises a large number of students who, for their pro bono educational experience at Harvard, many are now coming to the Delta to work on projects that I think we're all think is important. So without any more taking her material, let me introduce our lecturer this afternoon, Emily Broad Leib.
Hi. I know it might be hard to see me since apparently there are no short people in Mississippi and this podium's about as tall as me. Thank you so much for the introduction. I'm really happy to be back here. I really love my time in Mississippi, in Clarksdale. I was over here pretty often at the SSRC, which was my second home. And now that I'm back at Harvard, we have had so much interest from students in working down here that I get to still come back about every other month or so, and I've spent actually a lot of time in Jackson, which was my first introduction to that part of the state. So I'm going to talk today about forging a food system for our future, food law and policy. So I'm going to talk through, really, this is sort of an outline of what I'll cover today. I'm going to talk a little bit about, what we're talking about with the food crisis. What does that mean? Do we have one? Why are so many people talking about food these days? And then I'll talk a little bit about food policy. What does that mean? Where does the law fit in? Where do other fields fit in? And then I'm going to talk briefly about what cities and states are doing, and then also about what other universities are doing, what we're doing up at Harvard with our new food policy initiative and what some other schools are doing. And then a little bit, very briefly, just a sample of some things going on in Mississippi around food policy. So Dr. Cosby gave me such a great background that I don't have to talk that much, but I do want to say that, as he mentioned, I was in law school doing a lot of international work. My focus was in international human rights, and so it was a really big departure to come down and find myself in Mississippi. But it was so fascinating. I learned so much. I made so many connections that it really changed my career path, and I think has now had an impact on a lot of students at Harvard Law School who have now come down and spent time in Mississippi and spent time in the Delta and are seeing what things are going on. And Harvard's pretty internationally focused, and so we get really caught up in things going on in other countries, and we forget sometimes that there's a lot to be done here. There's a lot of need. There's a lot of people, trying to take things forward. And I just also want to briefly introduce the current Delta Fellow who's sitting up in the front row, Alexis Chernak, and then one of our students, Nate Rosenberg, who's going to be the next Delta Fellow. He's here for the summer, and then we'll be moving down here permanently starting in January. So I'll reference them a little bit, but they've been doing great work. Alexis has done a great job bringing forward some of the projects, starting new stuff, and Nate's getting really kind of indoctrinated now in what's going on at MSU, and then we'll be over in the Delta trying to meet partners. So I'm going to talk a little bit about the current food crisis, what that encompasses. So when I talk about a food crisis, I'm talking about a bunch of kind of different things that are going on. Obesity, overweight, type 2 diabetes, we'll talk mostly about that. But there's also an issue sometimes coexisting in that same population of hunger and malnutrition, especially now with the poor economic climate we've had. There's a lot more people that are in need that are not getting enough to eat. Food insecurity and food deserts, we'll talk about that. That's, people who can't get access to food either because they don't have enough money to, or because they live in a place where there's just no place to go and get, a solid source of nutritious food. Not to talk about everything on here, but just at the bottom, I have some poor educational outcomes, poor economic outcomes. And those are, when you have people that are unhealthy, that either are suffering from a diet-related disease or aren't getting enough nutrition, it's really hard for them to get up every day and do well in school and feel motivated to continue their education and to be productive members of society and, kind of be innovators and move things forward. Just looking at some of the statistics, in the U.S., some kind of recent numbers, we have about 34.2% that are overweight and about 33.8% obese. So this brings us to more than 2/3 of the U.S. are either overweight or obese. So it's a problem going on all over the country that we really need to be thinking about. And then it's happening among children as well. About 17% of children were obese in that same time period. So it's starting young, and going through people are older. And just looking quickly at Mississippi, the data I got for Mississippi was self-reported, so the rate was of obesity of adult self-reporting was 34.4%. Just to note that at the national level, when people self-reported, they self-reported the rate of obesity at 26.7%, when actually people are tested for their height and weight, the rate was really 33.8%. So I think, whether this is part of the problem as well, that people are self-reporting as not being overweight or obese because they might be looking around and saying, well, I look like everyone else. But the CDC uses the BMI between 25 and 29.9% as overweight, and over 30 is obese. And then as well in Mississippi, again, this is self-reported by parents, but the rate among children was 21.9% in 2007. So I think one of the big problems with obesity and overweight is that it leads to all these other health problems. I'm not going to go through all of them. Some are well-known, like heart disease, type 2 diabetes. Others are less well-known, and more research is coming out that obesity can be a risk factor for them, such as certain types of cancers, mental health conditions, reproductive difficulties. Alzheimer's disease even has been linked with obesity. And I want to talk about the cost that this has. So this, right now, I'm going to talk just about the cost in terms of actual health, provision of health care. And I referenced earlier as well that there's a cost to society from, the loss of productivity of people not feeling well or not, not being fully healthy. In the U.S., if you look at this graph up here, you could see that over the past 50 years, the rate of healthcare costs has really been kind of skyrocketing. And we hear about this all the time with, just really high rates of healthcare costs. The estimated total medical care cost of obesity in 2008 was $147 billion. It's really hard to estimate. I suspect the number is actually higher if you look at a lot of other health problems that are coming out of it, but it's safe to say that there's some large health costs associated with it, and it's been, in the past 20 years or so, been associated with about 27% of the increased health costs per capita. In Mississippi, I have a statistic up here that's from a few years back in 2003. The Mississippi Department of Education estimated that the cost was about $757 million of obesity in Mississippi. And I'm going to switch gears a little bit and talk about food access, which has been really a focus of like the work that we've done. And if you look at food policy from the local kind of small lens, access is a real problem. So the USDA defines food security as access at all times to enough food for an active, healthy life for all household members. And CDC defines food deserts as areas that lack access to affordable fruits, vegetables, whole grains, low-fat milk, and other foods that make up the full range of a healthy diet. So I think they're very intertwined. The first one, I think, encompasses as well people who might live right next to the grocery store but just don't have enough money at all times. Maybe they lost their job, they're on food stamps or the Supplemental Nutrition Assistance Program, but when they get to the end of the month, the money runs out and there's a week of eating scraps around the house or eating not very much at all. And the food deserts is more about the location of the grocery stores. In 2009, about 14.7% of U.S. households were food insecure. So those are the people that are having trouble getting enough to eat. And if you look at the South as a region, we have a higher rate here. In particular, the rate's about a percentage point higher at 15.9%. And you can see a few states are highlighted. Those are the ones with really high rates. And it's, rural states where it's really hard to maybe get grocery stores in every little town, which is understandable. And then finally, this map is actually really interesting. The USDA recently put together a map called the Food Desert Locator that shows the map of the U.S., and the pink things are areas that are considered food deserts. And according to their measurement, which they included as a food desert an area that's low income, so 20% of the households are in poverty, and about a third of them have difficulty accessing food at all times. And they found that 10% of the country lives in census tracts that are food deserts, so that's 13.5 million people around the U.S. In Mississippi, from 2007 to 2009, the food insecurity rate was about 17.1%. So again, going back to the U.S. rate, which was about 14.7, nationally we're a little bit higher. And this is even more kind of concerning that 25% of the children in Mississippi live in food insecure households. So if you think about it's, when kids can't get enough to eat, that's their stage where they're developing, they're learning, they're growing. That's really concerning, and that's something that is a really cause for alarm. And then looking at the Delta in particular, and I know we all know that there's a lot of issues there, and it's very rural and poor. This study looked at 36 counties in 3 states, Mississippi, Arkansas, and Louisiana, and found that about 70% of those living in low-income households had to travel more than 30 miles to reach a grocery store. And I think it's just striking because having lived up there for a few years, a lot of people don't have a car or don't have access to it all the time. There might be one car for the household, and it's if you have to get 30 miles to get to a grocery store with no public transportation and no car, that's not good where you're going to mostly be buying your food. You're mostly going to be getting what's nearby that you can grab. So why is this all important? As research and data start to come out, we're seeing that obesity and overweight is really, it's a problem at all levels of society, but it's really pooling in low-income families and neighborhoods. So 35.3% of individuals earning less than $15,000 per year were obese, compared to 24.5% of those earning $50,000 or more. So you can see there's quite a big divide there in terms of the rates. And then houses with income over 300% of the federal poverty level. The federal poverty level is about $10,000 a year for an individual and about $22,000 for a family of 4. So families who are earning 3 times that are spending 50% more on fruits and vegetables than those at the lower end, right around the poverty level, which makes a lot of sense. If those at the higher end, and even middle class and higher end of the income level, have more money to spend on fruits and vegetables, and they're expensive. You can spend a lot of money on them. They go bad. Sometimes you buy some and then you go down a few days later and it's gone bad, so you have to throw it away. So I think that kind of makes logical sense. And then this is very important that studies have shown that the groceries that you purchase in a supermarket cost about 10% less than groceries that are bought in a gas station, convenience store, corner store. This is huge. The people who have the least money to spend on food are having to spend the most money just to get their food. So, you know, if you think about how much it really takes them to get a healthy meal, it's almost nearly impossible. So just pull together some other themes. I think we can't hardly open up the newspaper these days or go online to read the newspaper as we do without hearing something going on about food in our country and abroad. There's been recently multiple outbreaks of foodborne illnesses, so food safety is on the front of people's minds. There's a really bad outbreak of E. coli going on in Europe right now, and they don't even know where it's coming from. Rising food prices. We're not feeling it quite as much here, but in other countries it's been a really big problem, and it's been linked with some of the uprisings and political unrest going on in the Middle East, like in Egypt and Tunisia, and even in the U.S. I think if you look into the matter, we're spending the same amount, but we're getting a little bit less possibly for our money. That food companies have to still stay afloat, so they're shrinking the packages a little bit so that they can still make their margins. Poverty, this is huge regarding food. We've talked about a lot about the link between low income and obesity, but it's if you look at the rate of expenditures on SNAP, which is the new name for the food stamp program, SNAP redemptions were about $14 billion in 2000 and about $64 billion in 2010, and that's an increase of 430%. So that's over 10 years. That's just massive, and we're still on the increase now because job numbers haven't come back. There's still people that need money to get food. And the last, just to throw out there, is this is another thing that's been in the news a bunch lately. The FDA was listening to hearings last fall, and they still haven't decided regarding genetically modified salmon that will grow twice as fast. And there's a lot of debate over whether is this what we need to do to feed the growing populations, and or on the other hand, is it could it be potentially have health consequences or have environmental and ecological consequences to have this fish that's not natural swimming around. So why is all this happening? There's a lot of reasons, but as an attorney, I'm going to talk about some of the legal reasons. So it's important to note that the way that laws are made, I'm going to talk a little bit about the laws that affect the food system from the federal, state, and local level, but once one law is passed, one major law at the federal level, let's say, then at every level below, people pass laws that take that as the baseline and as the foundation, and you end up building this structure that even when you pull one little piece out, one little brick out, and change that, the rest of the structure needs to be re-examined to make sure that it's still making sense. So I'll give just like a small example of work that we've done. We've been doing some work this year up in Memphis where they have a local food code, and the local food code is pretty outdated. They have trouble keeping it up to date, and a lot of it actually conflicts with state and federal law, so we've been trying to sort that out a little bit. But 2 years ago now, the state passed a law allowing for some in-home production of some foods that are low risk, things like baked goods and jams and jellies. And at this local level in Memphis, their law says no foods can be made or sold without a permit. So it took them 2 years to figure out how do we, mesh these two things together. The state law saying you don't need a permit to do this, and the local law saying we absolutely, without a doubt, will require a permit for everything. So that's just a small example, but it goes on all the time. When we change one thing, that everything else needs to be re-examined in order to make sure it falls into line. So what is food policy, and why is it important? Why are we going to talk about it? So food policy consists of actions and inactions by government that influence supply, quality, price, production, distribution, and consumption of food. So we're talking about everything here, from what's planted, how expensive is it, when we get to the grocery store, how much are foods going to cost, the different types of foods, what are people eating, and then what are they doing with the food waste, which is an interesting topic as well. So who currently controls food policy? This is part of the problem. Everyone and no one. I have a list here of alphabet soup of federal agencies. This goes on at the state level as well. At the federal level, just talking about some of these agencies that all touch on food policy. Of course, the Food and Drug Administration, they're, the obvious choice, but what they really are looking at is food safety and, in terms of foodborne illnesses and public health outbreaks regarding food. They put out some model codes that states can use regarding that. The U.S. Department of Agriculture, of course, they play a huge role in what we're producing in terms of agriculture, what's grown, farm bills. They also run, as part of the Farm Bill, the Supplemental Nutrition Assistance Program, which, as we just saw, is now more than $64 billion a year in redemptions. The Department of Health and Human Services, they run some of the other food programs like the school lunch, Supplemental Nutrition Program for Women, Infants, and Children, or the WIC program. The CDC, they're the ones that come in once we have these epidemic proportions of overweight and obesity and type 2 diabetes. They're the ones who have to kind of figure out what are we going to do with all these people that are unhealthy. Sort of an oddball I threw in Federal Trade Commission, because we'll talk a little bit later that they're involved now in looking at marketing of the foods, and particularly marketing to vulnerable populations like children and what impact that has. And Department of Education, of course, they're doing a lot around both, again, the school lunches, but also health and nutrition, what's taught in schools, that kind of stuff. So where are the laws coming from that, just to lay a framework of this? At the federal level, there's a few ways that the federal government is impacting the food that we're, bringing to our tables. Of course, there's some mandatory things. Recently, earlier this year, a new law was passed or was signed into law that was called the Food Safety Modernization Act, that gives the Food and Drug Administration a more mandatory control over what's done in states. Previously, I have, under suggested the FDA model code. So that was previously really what the FDA did. They put out model codes that states could choose to adopt or not adopt or modify. But now they'll have a little bit more authority to do their own inspections where there's high-risk things, and put out some scientific practices that should be used in food production. National School Lunch Program, the federal government says you need to serve this, and if you do, we'll reimburse you. There's, it's very set in terms of the number of servings, et cetera. Food labeling, this is done at all levels of government. It's something we're seeing a lot more of lately. In the Affordable Care Act, the healthcare reform that passed last year, there was some provisions in there that require food labeling for fast food or chain restaurants, any restaurant that has, I think, more than 20 locations, as well as vending machines. Suggested, I mentioned the model code. Also, national dietary guidelines, they just changed the food pyramid to a food plate. But they, of course, don't require that anybody eats that. They're just suggesting that. Funding is a huge way the federal government impacts states and individuals. These are just a handful: the farm subsidies, the SNAP program, WIC program, and a new program called the Healthy Food Financing Program, which is really a federal government effort to reduce the food deserts by giving funding to grocery stores to open a location in a food desert or to fix up their equipment so that they can provide more fresh food. At the state level, as well, we have laws and sort of funding mechanisms. Tax is a huge way that the state plays a role in terms of what we see at the grocery store, how expensive it is. What do we have taxes on? Is there a grocery tax? Is it the same rate as taxes on other goods? Food safety and health inspections, again, they're the ones that choose to adopt the FDA model code. And I think every state has adopted some version of it now, but the model code's updated every few years. But they choose what to accept and what not to. So Mississippi, I think, has the most recent FDA model code, but they've amended some provisions in it. Food labeling can be done at the state level. Procurement for schools and institutions, this is a huge economic engine. The state is purchasing a lot of money worth of food that they then provide to children in schools around the state, as well as state institutions and prisons. And we'll talk a little bit more about about that as an economic driver and a driver of health. And funding, again, at the state level, grants, tax credits, giving people tax credits to open certain businesses. And healthy food financing really was something that started at the state level in a bunch of states. And then at the local level, there's a few different mechanisms. Business licenses, a lot of cities and localities now are looking at how they provide business licenses and whether, if they're licensing a certain business, they can require them to do certain things to get that license. So they can say, you can't have this license unless you devote a certain amount of space to healthier food or have at least certain healthy foods. Zoning codes are huge in terms of what is allowed within the boundaries of that locality, whether agriculture is allowed, animal husbandry, whether they restrict where things can be located near each other. All of these things are the bread and butter of what local governments do with their zoning codes. Land use planning. This is a big issue. If there's a lot of vacant land, what can be done with it? Is there ability to give long-term leases to people to have certain businesses there? And then again, of course, food labeling can be done at the local level. So I'm not going to go through this slide too much, just to say that going back to some of the things we talked about earlier that are the inputs in the food crisis, on each one of them there are hundreds of policy levers that we could pull to make a change. And I think that's why it's so important to be looking at this food policy stuff at the local, city, county, and state level, because something that's going to work in Mississippi isn't the same thing that's going to work in Massachusetts or in California. So just, again, we talked about food deserts, food security. There's a bunch of things. We can be increasing places to buy healthy foods. For lack of physical activity, we can increase after-school programs, parks, equipment that's out there for people to use. The education, we can be, increasing the importance of health and nutrition education rather than making it an afterthought in schools, where, make it one of the academic subjects that everyone takes every year of their school. And barriers in the production and sale of healthy foods. There's a bunch of things. We can increase incentives for people to grow healthy foods. We can, do a bunch of things. So I'm going to just, not go through any others, but just to say that I think there's a lot that needs to be discussed in terms of what would work best and what resources there are. Is there, if there's not money in the budget, is there land to be used and given away, or is there zoning changes that can be made to just make it easier for some of these things to happen? So I'm going to talk a little about what cities and states are doing to forge food policies. For the next few sections, I'm going to talk about this in this metric of both looking at the process that we have and then the substance. So by process, I mean, what are we doing to bring together the, those alphabet soup of government agencies or the different stakeholders to figure out what's going to make sense, what can we change that's not going to harm one person, but it's going to kind of help the greater good. And then identifying the substantive changes that are needed. Of course, we need to figure out what changes are going to make the most sense so that we can do the right ones. So on creating an appropriate process and structure, I have a few examples of things going on in cities and states. One example is a lot of states have been really into farm-to-school programs lately, and have really put some resources behind making that a priority for the state. I think one thing to note is, this is, of course, important on the health side, getting fresher foods in the schools, but also, as we mentioned earlier, there's a lot of money behind this and potentially money that could be focused on in-state businesses and producers. And Nate has actually been a student in our clinic, which I'll talk about later, all year has been working on a report about farm to school, looking at what would maybe make sense for Mississippi, looking at some case studies from other places that have been really similar, and what could we do at the state level, what do we need to do at the local level, et cetera. So just to give an example, a lot of states have been hiring farm-to-school coordinators, and they'll be housed either in the Department of Agriculture or the Department of Education. In Washington, they created it within their Department of Agriculture. They put state money behind one person's salary, and that individual was able to parlay that into 3 full-time positions because there's a lot of money out there in grants and federal government money, so they were able to make 4-time people that are out around the state making this happen in Washington. At the city level, although this could be done at the state as well, these are just a few examples. Baltimore, Boston, Los Angeles, New York, a few other cities have hired what they call a food policy director that's housed either in the office of the mayor or within another city agency to bring together stakeholders, bring together local agencies, and look at all these different things, look at the zoning code and the business licenses and, what are the incentives? Are we making it easy or hard for things like farmers markets to open up? And then At the city, county, and state level, a lot of legislation is being passed creating food policy councils. And so when this is done through legislation or through ordinances, the makeup of the council will be set. So it will include, members of these following agencies plus stakeholders from these groups. At the state level, this has gone on in Illinois, New Mexico, North Carolina, Oklahoma. At the local level, Knoxville, Tennessee, Austin, Texas, New Orleans, Baltimore. I just read something today, actually, that they also just created one in Birmingham. So the membership is set by the authorizing law, and then the government is mandated to take into account the reports of that Food Policy Council. And in addition to the government-authorized food policy councils, a lot of folks around the country are coming together and forming voluntary food policy councils in places that don't have one. According to the Community Food Security Coalition, which is a national food security organization, there's about 20 state-level councils and about 100 total at the city, county, state level. And there's definitely pros and cons to a government council versus a voluntary one. One big example would be for the government ones, of course, that they have the ear of the government, that they're mandated to give reports and the government's required to take those into account. But one issue might be the people that are there as part of their jobs, and might not have had they're not there necessarily because they're really passionate about that, and they might move more slowly. The voluntary councils, mostly it's people who are taking time out from their job or their life to get there. They're really passionate, but they might have to scream really loud to get heard by the government. So, of course, there's pros and cons. And we'll talk a little bit later about a food policy council that's been going on in Mississippi. So that section, I was talking a little bit about creating a process. Where can we get the voices together from different stakeholders, different agencies? I'm going to talk a little bit the next few slides about what are some of the substance of what can be done. And these are just a random sampling of exciting things, new things that either directly affect Mississippi because they're going on at the federal level or that could be done here. One big one is, I mentioned earlier the Federal Trade Commission. There's been an interagency working group on food marketed to children, and it's been the Federal Trade Commission, Food and Drug Administration, Centers for Disease Control, and U.S. Department of Agriculture meeting to talk about this topic. There's some precedent for this because unlike most speech, which is protected under the First Amendment, commercial speech and advertising can be regulated if it's targeted towards vulnerable members of society. So they issued preliminary principles to guide the industry around nutrition marketing towards children. This is very preliminary, and they're actually not required. They're just sort of best practices that industry could choose to do or not, but I do think it shows us something that could be coming up around the bend, that there could be restrictions eventually at the federal or state or local level on what we're seeing. And it makes sense that, if your kids every day they're watching their programs on TV and they're seeing everyone eating, fast food or unhealthy meals, it's hard for them to maybe notice that that's just a commercial. It's made to want them to eat those things rather than just this is what people do. Another example, going back to the farm to school, at the federal and state level, there's been talk of how can we preference local foods. So sometimes local foods might be more expensive, especially if that local state has or area has not been providing food to the schools or institutions until that point. So the USDA just came out with a geographic preference rule which says states are allowed to preference food grown within a locality or within a state if they want to, even if it's more expensive and even if it's going to cost a little more to purchase that. So that was really great. It opened the door for, I think it was allowed before states were doing it, but they really made it clear we want this. States can go ahead and do it. And then some states have been passing rules saying not only is it something we want to do, but actually we are mandating that in Massachusetts, state agencies and state colleges shall purchase food that's grown in the Commonwealth of Massachusetts. And they've, in that legislation, said that if the food grown in Massachusetts is anywhere under 10% more expensive than the food grown in another state, that they have to purchase that. And so they kind of set that number out right in the statute there. I think one thing to say about the farm to school programs, who will be around here for the next few weeks and can talk with anyone about this more. The economic potential is huge. We looked at a study that was done on a pilot in 2 school districts in Oregon, and about $65,000 was put in to make it possible to purchase the local foods, and it resulted in the district spending $235,000 on local foods. So that was, they put in a little bit of money to make it possible, and they ended up with a huge outcome on local purchases. And again, this can be local, it can be at the state level, but why wouldn't we want to, make that money circulate in our own economy? And then on the health outcomes, just it helps, to have the food be fresh. It's more nutritious. It doesn't lose its vitamins by being shipped halfway across the country. And it also can be used in things like salad bars, which a lot of schools don't have. And studies have shown that in schools with salad bars, the increase in consumption of fruits and vegetables has been anywhere from 25% to 84% among those children who have access to the salad bars. So, again, if we're getting food from California, we might not be able to have it in salad bars every day of the week, but if we're getting food from nearby, from Mississippi or nearby states, we can. Fresh food financing initiatives. I mentioned briefly the federal government initiative, which has, I think, $400 million over the long term and $10 million to spend this year on helping grocery stores in food deserts to open new locations or to update their equipment. This really started, Pennsylvania was a forerunner in this. In 2004, their legislature passed legislation creating such a fund that would provide both loans and grants to grocery retailers, and this was increased exponentially with grant money from foundations, and in the end they were able to fund 88 projects so far in 34 counties in the state that either started a new grocery store where there wasn't one, or that took a corner store or even a bodega or whatever was there that people were buying food from, and added an addition on or updated the equipment so that fruits and vegetables could be stocked there at all times. And if that's where people are shopping, we have to get the food to them. Another exciting thing going on around the country is helping give benefits when people spend their SNAP food stamps or WIC vouchers at to buy healthy foods. This example from Michigan, the Double Up Food Box program, they provide vouchers for people who spend their SNAP at a farmer's market. So if someone spent $20, they would get that $20 matched back to them. So it's a $20 limit for the match. So if I went to the farmer's market tomorrow and used my SNAP to buy $20 of food, I would get $20 in tokens to use at that same market. So again, just like the farm to school, this is not only really helpful for health because we're encouraging people to buy the healthy foods, but also it's really helpful for the farmers who are getting, everyone's coming with this source of money and it's a huge revenue stream for them. At the federal level, there's a pilot going on that was funded through the last Farm Bill to do what they're calling a healthy incentives program, and it's taking place in Hampden County, Massachusetts, and this is in the grocery stores themselves, where when people spend their SNAP benefits on fruits and vegetables, they get a 30% increase in the amount of money that's on their, in their account to use. So they're trying it out. We'll see what happens, but anything that can, incentivize the purchase of healthy foods and make them more cost effective. This, kind of smaller scale, a few examples at the state and local level. One has been some, I mentioned a little bit before, business licenses. So in Minneapolis, they passed something called the Staple Foods Ordinance that required any store that was a grocery store, convenience store, gas station store that was selling food to stock certain kinds of foods. So they included that at least 3 varieties of 4 kinds of food had to be stocked at every time. And it was, the 4 food categories were fruits and vegetables, breads and cereals, dairy, and then meat and protein. And I know some of those things you're already going to find in a convenience store, but some, like fruits and vegetables, you might not, and you especially might not find 3 varieties of them at any time. Another thing that's gone on is some local levels was the banning of certain foods like trans fats. This happened famously, New York did this a few years ago. More recently, Montgomery County, Maryland passed the same thing, which says any food that's prepared in a restaurant being prepared and then sold to people can't include trans fats. So it's less strict if the foods are processed previously and brought in packages, because there's not a lot you can do if you're selling them, but they definitely have to make sure not to use it in food that they're preparing. Zoning codes, just a few examples. I talked a little bit about zoning for certain uses. One example, in Baltimore, they have a new zoning program that they're calling Transform Baltimore. They realized that they had a lot of, it's a city that's being depopulated, so they have a lot of vacant land, and it was just laying vacant. So they decided to start a program where that land could be long-term leased to urban farmers. They have two programs, one for farmers that are, doing this for to make a profit and have a real business, and the other is for nonprofit training of new farmers. And then also zoning to prohibit certain things near each other. An example is from Detroit, where they prohibit fast food restaurants from being located within 500 feet of a school. So that's not that far. You could maybe go a little further than that, but we don't want kids coming out of school at their lunches or right after school and walking directly into a fast food restaurant and getting all those foods that they don't need to be eating. And then a good example of helping make it easier to produce local foods. So one issue that's going on around the country, and I know it's an issue in Mississippi as well, is capacity for slaughter of poultry and meats. So one state, Vermont, actually, the legislature saw that this was a huge problem, and the legislature themselves put up money to purchase mobile processing units. One was a mobile poultry slaughter unit, and it's great because it can go out and cover a really big area of the state where the cost for each of the farmers to bring their poultry to one location to get it slaughtered and then bring it back was so great that some of them couldn't keep doing that. This can go out and be at all the different farms and help slaughter the poultry right there, and they have a schedule of where they're going to be. And they also even purchased a second unit that was a mobile quick freeze unit that could freeze produce and berries. And again, this wasn't, no one, I think no one complained, no one said we can't, we need this, this is the, this needs to be the law. It was the legislature looking and saying, this is going to be a problem. If it's not a problem yet, it's going to be a problem in a few years, and what can we do? And this input of money will result in, greater tax, money coming back into the state that we can then use to, recoup our expenses. I want to just note quickly that as I was putting together these examples, of course I wanted to use as many examples from nearby as I could. And so I tried to incorporate some, but you'll see a lot of them are really taking place in urban areas, in the Northeast, in the West Coast. I think it's actually exciting because it means that we can really get out ahead of the curve here in Mississippi and be a leader in the South in terms of doing some of these things. And I know that it's nice to hear things that are going on nearby, to know that they're going to work in a similar place, but we're going to have to be the innovators that take some of those risks. So I'm going to talk a little bit about what universities are doing and what, how they've gotten involved in this work around food policy. So I'll talk mostly about what we're doing at Harvard at the law school with our new food policy initiative. And remember, this came out directly of, it started this fall when I got back to Harvard, and it came out of the work here in Mississippi and in the Delta around seeing this problem and then starting to do some research and realize, hey, this is going on all over the country. It's not just here. This is like cutting edge. It's what's on the top of everyone's minds. So I'm going to just briefly describe what a law school clinic is, because it's housed within the clinic that I work in. So a clinic's an opportunity for law students to get some hands-on experience. In the past, students would go to law school and they'd sit in a class all day and hear lectures, and then they'd go out and have real clients. And a lot of them didn't feel prepared to do real work because the academic and the practice were so disjointed from one another. So the clinics all have a course component. Our clinic meets 2 hours a week with a seminar that we talk really about the substance of the actual laws themselves, and students can share what they're doing. Clinics can be direct services or policy work. The early clinics were really direct services, like helping a low-income individual who needed help getting a divorce or getting custody or getting a restraining order, and now a lot of clinics do policy work as well. Clinics can be local, national, or international in their scope. When I was in law school, as Dr. Cosby spoke about earlier, I did a lot of international work, so we were kind of spending a lot of time outside the U.S. Most exciting is that clinics are really an opportunity for innovation because we have a lot of really eager students, and Since I started here in the Delta, it's been about 3 years of this Delta Fellow program with SSRC. We've had about 100 students do something related to the Delta work, whether it's through food or something else, and they put in incredible amounts of time, and they're willing to look at the things that these small community-based organizations or even state agencies in states that right now don't have a lot of money in their budget don't have the time to do. The food policy initiative is housed within the Health Law and Policy Clinic, which has been around for about 20 years. The mission of the clinic has really been to increase access to health care for vulnerable populations, like those that are low income, living with chronic diseases. And so again, we really look closely at improving access, a lot of advising state government officials on policy changes and implications, whether it's comparing different states or how is something at the federal level, like the Affordable Care Act, going to impact states and how can they get ready for that. And then also a lot of mentoring, training, technical assistance. So the food has been a new addition on top of that. So going back to the metric we talked about before around the creating the process and structure, and then looking at the actual substance of the policies, just to talk a little bit about where some of the food projects that we've worked on here came from. One of the first things up in the Delta was that around the state, really, the past few years, there's been a lot of growth of farmers markets. There's about nearly 60 markets around the state of Mississippi right now, and there were lots of new markets springing up in the Delta. So we kind of brought them together, had some students come down to interview them, and we put together a list of the technical assistance and legal questions they had that were getting in the way of them doing all the things they wanted to do or being really successful. And it also was helpful to them to be able to network and hear best practices, because it's really hard to operate a farmer's market in a really small little town where, it's hard to get the word out, or you might not have enough growers, or some people don't know what a farmer's market is and haven't been to one. And then more recently, about a year ago, I worked with the Mississippi Health Advocacy Program down in Jackson to start a voluntary food policy council. And it's really been a small group of people from around the state, from different fields, growing, farmers markets, health educators, health professionals, kind of talking about this. And it's been pretty informal, although the group's about to elect a board, and then we'll, I think, get more in the process of having bigger meetings, more things around the state, doing more education. So one of the first things we did as a group was, after deciding, do we want to do this, does this fill a gap in Mississippi, we looked at what were some of the doing some strategic development, what were some of the issues, and then built some consensus around the most important ones we kind of prioritized. And that's actually been the list of projects that we've been working our way through in the food policy initiative this year, starting from things like farm to school, and we looked at a little bit at like risk management for small farmers, what can they have access to, and going through this whole list of issues that people who came to the table raised as questions or areas that they thought could be improved. So I'm just going to talk about a few of the projects we've done. So one of the first ones we did was in bringing together the farmers markets and realizing they had all these questions that were, so many of them we interviewed, the students all went out and interviewed different markets and came back with the same set of issues. It was, what is the sales tax? When do we need to charge it? How do we do that? Do we need insurance? What does that mean? What do we need to insure? What are the basic food safety rules? What's the difference between selling a tomato and an egg? So we put that all together into a guide, and all these things are available. I'm happy to share them with anyone. And we just recently updated that because there have been some changes in Mississippi that affect farmers markets. So a 2011 version was just released. Coming from that, we'd been looking a little bit at models from other states to do that guide, and we started to notice that in other states, farmers markets are mentioned in their laws a lot more, and they had a lot of more provisions that were really working to make farmers markets successful. So we put together a few recommendations looking at legislation from other states, and one of the ones that ended up being really successful was looking at the sales tax in Mississippi on markets and noticing that the law was a little bit unclear, so it wasn't clear whether produce sold by farmers in a market should be tax exempt or taxed. Is it more like farmers selling off their farm, or is it more like a grocery store? And one of the big problems was we were encouraging, by not having that clarity, we were encouraging farmers to just pull up their truck on the road and sell, which there's nothing wrong with that. I love buying, tomatoes and watermelons on the side of the road, but people in communities didn't know when that was going to happen, so they couldn't get together, get organized, and go to the place where they knew the fresh produce would be. So the sales tax was changed in 2010 so that now any food product sold at a farmer's market is tax exempt. Farm to school, I mentioned briefly that we've been really looking at this. We have just literally this morning finished this report, which is hopefully going to be really helpful and just has information about how procurement and the school food purchasing works in Mississippi, what do we need to change, if anything. I mean, there's a lot that can be done with the structure we have right now, but how do we want to do that? And I'll leave Nate, Nate can answer questions about that as well. He's right up here in the front. I'm going to just quickly mention a few others. We did some looking at using food assistance programs at markets like SNAP and the WIC Farmers Market Nutrition Program. We looked at in-home food processing for low-risk food items, which is something that's going on, and it's legal now in about 34 states, to produce some things in a home kitchen that can then be sold at a farmer's market. We looked at the WIC program. The Mississippi WIC program is the only state in the nation that still does their WIC through the distribution centers, which has a lot of benefits, but also it's about $74 billion a year that's spent on food that could be going potentially to farmers and farmers markets and these small grocery stores. So we looked at that. We looked a little bit at the risk management. I mentioned briefly before, we've been doing this year-long project trying to help revamp the Memphis Food Code, which is just completely out of date and has things in it like, it's nearly impossible to open a farmer's market. There's no way to do any mobile vending, mobile food trucks, whether it's like a truck selling fruits and vegetables or a prepared food truck, aren't allowed to stop ever. So they're supposed to constantly be in motion, which, as you can imagine, people trying to pay while they're chasing the truck down the street. We did a small project in Arkansas. They had, wanted to make sure that the provisions that were intended to protect farmers were actually protecting farmers and not just resellers of food. And then coming up this fall, in addition to the work we're doing in Mississippi, we're going to be looking at a project in Pennsylvania around a really restrictive law that just came out around farmers markets. And then in Massachusetts, they have some provisions in their laws that make it really hard to use food waste in a beneficial way. So a lot of food is getting thrown away that could be, used for people who are going hungry. So just briefly, we'll be this year. We've just been teaching, doing the clinical work around the food projects, but the students have been coming through either pro bono, which means just volunteer students, or through the Health Law and Policy seminar. And starting this fall, my boss, Robert Greenwald, and I are going to teach a course on food law and policy, which is the first course at Harvard on this topic, which is really exciting. We're going to look at the current food system, some of the stuff I talked about, and we're going to look at domestic and some international stuff as well. We're going to look a lot at agricultural policy, both what are we encouraging people to grow and what not, what's easy, what's hard, sustainability, what does it mean to grow things organically? Is it feasible to actually feed people with things that are organic or not? We'll definitely look at food safety. We have a few interesting things to talk about there, and then government food programs. The ones I mentioned are the big ones, the SNAP program, WIC program, the school lunch, and then we're going to look at other countries a little bit and just see what they're doing and what whether we could kind of take a lesson from what other countries are doing here. We're going to talk a lot about nutrition, how the U.S. kind of educates people about nutrition, whether the guidance is useful. We talked a little bit about labeling before, and I think there's some question over whether food labeling actually helps people make better choices, whether you actually know what you're looking at when you look at the labels. And then finally, a big segment on some solutions, so increasing access, improving education, using the court system. There's some stuff that can be done using litigation, and then changing policies and et cetera. So I'm not going to go through this slide. I just wanted to show on this slide and the next a few other schools that are doing really interesting things. University of Arkansas had the first agricultural law LLM program, which is a master's in law program, and then I think it was last year or the year before, they just expanded it, and now it's a food and agricultural law LLM program. So that's really exciting that they're noticing this and bringing that in. Another good example, the Yale Rudd Center has all different folks coming together to talk about obesity. They have PhDs and MDs and RNs and lawyers talking about obesity. Michigan State is a good example of a university that has been really involved in farm to school in their state. We talk about this in the farm to school report that we, as a case study, but they really help to coordinate the farmers and the schools in local areas that could be working together through surveys and trainings and making guides. Again, a few other schools. Another example would be Iowa State, which has a program where they really help beginning farmers that are growing, a lot of food products using sustainable methods. And then, just above that, Washington State also was really involved in farm to school, especially the King County Extension Office, which helped do a farm to school program in Seattle. So finally, I'm going to, last few slides, talk a little bit about a few things going on in Mississippi that are exciting. Again, using this metric, what's going on around creating this process that we could use. The first, which I mentioned earlier, is the Food Policy Council. It's been, again, a small group steering committee of stakeholders have been meeting up for about a year and are about to elect a board. This year, some exciting legislation passed that creates an advisory committee to look at the access issue and the retail availability of healthy foods around the state and the implications of the lack of access, and as well some solutions. So it's a short-term advisory committee. I think it only runs through December, so they'll have to get some stuff together really quickly, but it's still an exciting way to get some voices heard. The Food Trust is an organization in Pennsylvania that was instrumental in that Pennsylvania Healthy Food Financing Initiative, and they have also worked in a bunch of other states, and then recently are now have a grant from Robert Wood Johnson Foundation to look at a few southern states, Mississippi, Alabama, Tennessee. So they're going to be gearing up, I think, later this year. They've had a few meetings, but just what can be done, and it ties in well with actually the legislative task force that was created, that potentially there's a lot of room to meet there and think of some strategies. This is something going on at the coast. Just to give some examples of regional things versus statewide, there's a Sustainable Communities grant that has looked at a bunch of things at the coast, but one of the biggest things is looking at the food system, and they are really comprehensive, and it's just impressive the ideas they've gotten, just everything from seed to composting at the very end of the trail. And this is an example up in the Delta that Alexis actually has been really involved in as well while she's been up there, which is the Delta Fresh Foods Initiative. And this really brings together a bunch of the people in the food system to less about policy, but more about the creating a market. What do we need to do? We need to train some farmers. We need to get more people growing some food items. We need to help the farmers markets get to where they're be able to really provide enough food and be a driver. And then on the substance, so those were again the creating ways to bring voices together. On the substance, one thing that happened for the past few years, the Mississippi Department of Agriculture and Commerce has had a market certification program where it's great because they're helping to identify who are the real farmers markets in the state and what does that mean, but also they give the markets about $300 to use for advertising, getting their name out there in the newspaper, getting stickers. So this is one of the biggest problems for these markets. The growers all get there, and where are the people who are going to buy all the food? This was the last legislative session, the provision that I talked about that gets rid of the sales tax at farmers markets, which is really exciting. And again, it wasn't much money that was coming in from those, but it was a real headache for each individual farmer to account for the 7 cents here and the 7 cents there to submit that. Department of Agriculture and Department of Human Services this year just received a bunch of free EBT, electronic benefit transfer machines, so that now at farmers markets around the state, people will be able to use their SNAP benefits. And this is, they piloted it last year in Jackson, and now there's, I think, last count that I heard was about 84 machines are going out around the state to farmers or farmers markets. So that's really exciting, and maybe the next step is looking at some of those incentive programs and bringing some of those in. The Department of Health and Delta Health Alliance is another example up in the Delta. They've been working with like faith-based communities to improve health in a bunch of ways, but one has been helping a bunch of churches to build church gardens. And it's exciting because it's both a way to get people together, the food is available for the members of the church to eat, but it's also training people. They have people to do the technical assistance and training so that the growers, if they wanted to, could go home and grow something in their own yard and save some of the money that they would have to spend on food. Finally, another example is this has been meetings going on this year with Department of Health and the Department of Agriculture, and also some folks up here at state in the food safety program around whether they'll allow permits for some low-risk foods to be made in a home kitchen. And again, it's something that's going on in a lot of states, and it's helpful for the small growers because they can make a bigger profit on the foods that they make that are a little bit value added, and it's a way to use the produce that they don't sell. We had one grower up at the Clarksdale market that would sell, every week he'd come with bushels of sweet potatoes, and if everyone in Clarksdale bought his sweet potatoes, there would still be some left over. So if he could have taken them home and made something out of them, and then the next week sold more sweet potatoes and his sweet potato bread or whatever it was, it would really be an economic incentive for him. So that's it. I know that was a lot. Here's just quick my contact information. If you email me, if you want any of those reports, I can pass them along. This list here is all the kind of relevant sites. The Legal Services Center, which is where I work. The Delta Direction sites have a lot of those papers posted up there. And then there's some information on the Mississippi Health Advocacy Program site about the Food Policy Council. So I guess I'll take some questions, but remember, there'll be no heckling of the speaker, or you'll have to contend with the SSRC folks who are here. I think that's a great question. I think there's sort of two ways to look at that. In one sense, in any choices that we make, of course, the money has to be spent in one place versus another. But I think one of the problems is the more states start to do this and start to focus on spending money locally and growing their own economy, I think the more if we're behind that, we're going to start losing the stuff we're sending in other places. So, I think it's a great point. I don't think once it's almost like the train is going in a direction and it's hard to go back. I agree, and I think it could be potentially a problem in terms of even other countries where we're buying a lot of stuff. But at the same time, I think there's some efficiencies, some money to be saved by not buying things from far away. And so in a sense, the pies can be growing, completely, like not spending as much money on transportation costs and fuel, especially right now, it's just through the roof. So potentially more money could be spent overall. It might be better for everyone. That's a good question, actually. A few states and local areas have been trying to get permission from USDA to restrict certain things that are purchased, and until now USDA has not allowed that. We're still waiting. New York City was most recent. They wanted to prohibit use of food stamps to buy sodas, which there's a lot of pros and cons to that. A lot of people from the hunger side are up in arms because they think it's a sort of a slippery slope to go down. Once you restrict people on some things, are we going to be just telling people what they can and can't buy? At the same time, if there's certain things that are really bringing no health benefit to people, then it might be wise to say, you can buy those with your money, but if we're going to be the ones paying the health costs in the end, why should we also be paying for you to get those foods? But from Washington itself, there hasn't been any discussion about, as far as publicly, there hasn't been discussion about that, and we'll see. I think what they end up coming back to New York City with. That's a great question. Actually, I'm not really sure that there's necessarily in the same way that there is for fruits and vegetables. That huge benefit in terms of eating something that was grown right around the corner and eaten the next day. I think the issue is more probably the producers themselves saying, we've been doing this for years. My family's been, raising poultry for decades, and because the federal restrictions get tighter and tighter, it makes it harder and harder to operate a slaughter, a processing location. Some of those were shutting down. And I know this is a problem here, maybe not with poultry in Mississippi, but around beef processing, that it's really expensive to operate one of the plants that's federally or state inspected. And so if you have one in one place, only people who are near there can really use it well. And so I think consumers probably were not as much. I mean, I will say about Vermont that they're really into, local foods, organic foods, sustainable foods. So it could be that they want, they know things grown in their own state are going to be grown with that value set, and people did have a priority for eating local stuff. But I think it's more just that people were going to be going out of business and losing their jobs if they, if they couldn't find a place to process their goods. I'm not sure. I don't know. I mean, I don't know, what the results have been really. Just that they tried it out. And Massachusetts has done the same thing recently, although I don't think they purchased the units themselves, but they just did a pilot with helping to staff mobile units for poultry slaughter in Western Mass, and it was really, really successful. So they've scaled that up. So I don't know what the calculation was done at the outset. I think most states have said, there's cost to start up one of these. Let's try it out and see what results we get. And then if it works out well, let's staff some more. I mean, again, Mississippi is a big state. Vermont's smaller, but still, you're not going to have one unit cover the whole state. So, of course, they probably got one. They said, we'll cover this one region. If it's successful, we'll take it to the next level. But I agree it's an issue. And I think, all the things that are grown, sustainable, organic, I mean, they're through the roof. I can, only imagine that many people wouldn't be able to afford them. The cost actually may be less to the consumer because, again, we talked about transportation costs. So with fuel costs as high as they are, if people are buying things local, they're not paying that extra bump in price. We had a comment from Linda Southward at SSRC about a new program kicked off today by First Lady that's about extending the Let's Move program to young children in child care programs. And so just to keep in mind that eating habits are set when children are very young, and the policy and the research and all the work we're doing really needs to account for that as well, which I think is a great point. I mean, we talked about what kids are eating in schools, but by the time they start school, they want to eat the things that they're used to eating or seeing on TV, and we need to focus on that. Thank you. So I think two things to say about that. One is that for the most part, when foods are sold that are produce that's grown and sold whole before you do anything to it, there aren't that many rules if you're selling directly from farmer to consumer. And there's a few reasons for that. I think it's hard to be growing things on the scale that can really harm a lot of folks if you're just selling directly to someone. You can't be selling directly to a billion people. So traditionally there weren't requirements regarding that, and that extends at the farmers market setting, that if you're selling produce, it gets a little more difficult when you start doing something to the food, processing it in some way. I think in the stuff we've looked at, again, since a lot of the states that have changed something regarding some of the in-home production, they haven't had really negative outcomes because they've been kind of strict on what that extends to. So most states will say it's still only at farmers markets, so it's still only when I can look at the person that I'm buying it from and they can say to me, this was made in my kitchen, it wasn't inspected, here are the ingredients, and I'm selling to a certain small set number of consumers. And states have been strict also about what can be included in that. Only things that really don't have potential to unless someone does something really wrong to them to be unsafe. And so I think states have haven't really I haven't seen anything that said there's been a really bad outcome from that. But again, they've been strict, and some states have even gone so far as to put a limit on the amount of sales per year. So to say, if you sell more than $15,000, we think you're at the level that you can afford to fix up your kitchen and get it permitted. So I mean, I think it's a question, it's an issue, but I mean, the other thing to say is that it goes on already now. I mean, we allow it at bake sales. There's an exemption in the FDA code that every state, including Mississippi, has passed that says food sold at bake sales that's made in a home kitchen doesn't have to be inspected. So if we think the good citizens that are donating to churches and charity groups, if that food is safe enough for them, then I think there's good reason to say that we haven't for years had that and had major problems, that it should be okay in the farmers market setting with those certain products.
I would like, before we close, to ask Nate Rosenberg to please stand up so you can see what he looks like again. Nate is a third-year law student at the Harvard Law School, and he has a fellowship from the law school to be in Mississippi this summer. He's going to spend 6 weeks here at MSU and 6 weeks over in the Delta. His really big job of the 6 weeks at MSU is to network this program into as many places on MSU's campus as are interested to participate in this program. So Nate will be here full-time, 5 days a week. He actually will be here 7 days a week, but he's available 5 days a week to talk about possible cooperation, synergistic activities, or just to find more about the program. He has a keen interest in food policy. He started the first student group at Harvard last year, and it quickly drew to 150 students. So in a university that we hardly think of as an agricultural university, it's a place that there's a keen group of people interested in food and food policy. So with that, I would like to close the formal part of the session. Please come down and ask Emily questions if you wish. And thank you so much, Emily, for coming down and give us a wonderful